Hi, my name is William Johnson and I'm a respiratory therapist student here at Miami Dade College. Today I will be demonstrating to you how to perform trach care. There are reasons why we perform trach care. Some of the reasons that we'll perform this procedure are to maintain a patent airway, to maintain skin integrity, to prevent infections, to avoid accumulation of secretions in and around the tracheostomy. Some of the indications that we do this procedure will be for any patient that has a tracheostomy. Contraindications would be any patient with unstable vital signs. And the hazards that we need to look out for are any patient that has respiratory distress, that are experiencing bleeding, that have hypoxia or hypoventilation, and that has tachycardia. So the first thing I would like to do to perform this procedure is we want to take a look at the physician orders to verify that the patient does require trach care. And I'm looking here, our patient name is Mr. Brown, and he does require trach care ordered by the physician. So what we'd like to do is we'd like to make sure that we gather our equipment, and the equipment that I have here for this procedure today is going to be a trach care kit that has everything inside for this procedure. We're also going to have a trach care tie. We have our suctioning equipment here. We need to have our BVM and our suctioning tubing here that goes connected to the wall. The next thing I would like to do, go ahead and move this out of your way. I would like to go ahead and wash my hands after I do my introduction to the patient. So I will come in the room. Hello, Mr. Brown. My name is William Johnson. I'm a respiratory therapist student, and I'm going to be here to perform trach care on you, and we'll clean up around your tracheostomy. So I'm going to go ahead and wash my hands now that I've made my introduction to the patient. And I'll wash my hands for 15 seconds thoroughly. Once I wash my hands, we'll go ahead and put on a pair of gloves. Okay, and I'm going to come back to my patient, Mr. Brown, and I'm just going to go ahead and verify his ID by looking at the bracelet on his arm and matching it up with either his name, or also we can also match it up by date of birth or medical record number. And I have two of those, so this is the correct patient. All right. The next thing I want to do is make sure my patient is in a 45-degree angle if he's not. But our patient is already in a 45-degree angle, so that's fine. I'm going to go ahead and check for our first baseline vital signs. And what we'll be checking is the respiration rate, the heart rate, the BP, his pulse ox, and the temperature. And I'm also going to go ahead and listen to his breath sounds. While listening to breath sounds, if I hear that my patient is experiencing some type of crackles or rhonchi, then that means that he will require suctioning. And if so, we have the equipment here, and we'll hyperoxygenate this patient and go ahead and do the suctioning. In this case, our patient is fine. They don't require any suctioning, so we'll go ahead and continue with the procedure as planned. So I want to go ahead and remove the trach dressing from the patient, and we'll go ahead and throw that to the side here. And I'm going to remove my suctioning equipment because it's not needed at this moment. What I would like to do now, I would like to open up my trach care kit and remove the contents that are inside. And we'll also place this to the side. My next step would be to remove the sterile fill paper. And now we have a sterile fill. I'll remove the contents from my trach care kit, and we're going to keep this because we're going to need these compartments to perform our procedure properly. So, what's located inside of this kit is a normal saline bottle. It has sterilized saline in it. We have our trach care dressing. Put that to the side. And we have some 4x4 gauzes for cleaning. I also have a brush to clean with. and 2 Q-tips. Hydrogen peroxide, and a set of sterile gloves. So I'm going to go ahead and open the sterile gloves. And we're going to place on the sterile gloves now. Adjust the fingers to our sterile gloves. Like so. Now that we have our sterile gloves, we'll go ahead and remove this paper now. And we'll throw it in the trash now. So, our sterile fill, what I like to do is I would like to go ahead and in the sterile water, and we'll pour this in all 3 components of the tray. We'll take our hydrogen peroxide and we'll place it in the largest portion of the tray, giving us a mixed solution. Okay, next thing I would like to do is I would like to go ahead and remove my patient's inner cannula. We have the inner cannula, and I'm going to go ahead and place this inside the compartment that has the peroxide and normal saline. And we'll let that sit for just a moment while it breaks up some of the mucus and everything that's located on it. In the meantime, while that's setting, I'm going to go ahead and take a 4x4 gauze, and I'm going to dip it in the peroxide, and we're going to clean around the patient's flange and around the tracheostomy. Again, cleaning the skin and the plastic area, making sure there is no visible dirt or anything that's around it. We'll clean that. Put this over here. I'll discard of this. And what we'll do is, the next thing would be to use a Q-tip, dip it also in the peroxide solution, and come back over and clean it again, a little bit more thoroughly this time. So we're trying to get the hard to reach places that we couldn't get the first time, in and around the flange and the skin. Once we do that, bring this back, and I'll discard of this. I'm going to grab another 4x4 gauze. I'm going to dip this one this time in a compartment that has normal sterile saline. I'm going to come over, and I'll pretty much wipe this down again, making sure everything is clean, just as I did the first time. Get all behind as much as I can, and we'll discard of this. Next thing I would like to do, I would go ahead and grab another Q-tip, and I'm dipping this also in normal saline. And we're going to come back through and clean again, and make sure we're wiping off around the flange and the skin thoroughly. Okay, and we'll discard of this. While we're doing that, I'm going to go ahead and grab the inner cannula and the brush. I'm going to make sure I brush the inside of it. Give it a thorough cleaning in and around. And I'm going to go ahead now and place this inside of the area that has the normal saline. And we'll go ahead and shake this off and sit it here to dry. Okay, so now what I would like to do is I would like to go ahead and apply our trach tie to our patient. So I'll remove one side of the trach tie that's already existed on the patient while holding down the flange to the other side. And I would place the new one in, like so, while removing the older one. And I'm not letting go of the flange as I'm doing this to maintain stability of the patient's tracheostomy and flange. I want to make sure I hold it and secure it. Now, it's in place, it's nice and secure. That's great. So what I would like to do now is, I would like to go ahead and check my patient's vital signs. We'll reassess and see how the patient is doing. What I'm gonna do is I'm gonna assess the patient's lung sounds, and what I'm listening for is to make sure we still have good airway, and the airway is patent. As long as the patient's airway is patent, we've done a good job. Now, after checking the vital signs, I would like to go ahead and reinsert the inner cannula. And when I reinsert the inner cannula, now I would like to go ahead and lock it in place. With that being said, I want to go ahead and clean up my area, and we're going to go ahead and dispose of everything that's in this area. And we'll discard this in the trash. So, now I'll ask my patient, Mr. Brown, is there anything else I can help you with today? Are you fine? Are you comfortable? And I'll remove my sterile gloves as I wait for him to answer. And if he is okay, I'll discard my sterile gloves, and I'll go ahead and remove my normal gloves, discard those, and wash my hands for 15 seconds. I'm washing my hands 15 seconds thoroughly. Patient is doing fine. So what we'll do now is I will go ahead and chart. And that'll pretty much be the end of this demonstration. Thank you.